Good morning, Mary. How are you today?
Hi, it's so nice to meet you. We're so happy to have you visiting the Debbie Institute. My name is Kathleen Figueroa. I am the director of the Debbie School, and I've been here for many, many, many years. I helped start our program for children with hearing loss. The Debbie School is a center for young children with disabilities. We are a division of the Mailman Center for Child Development, which is part of the Department of Pediatrics, which is part of the Miller School of Medicine at the University of Miami. People often wonder why we have a school in the middle of the medical school, which is very unusual. This is a demonstration school, and it was really designated by Abraham Mailman, who was one of the founding partners with his brother Samuel of the Mailman Center for Child Development. His granddaughter, Debbie, had cerebral palsy, and that was why he really wanted there to be a demonstration school. And there have been many research projects and pilot programs that have started here at the Debbie School. For example, the pre-kindergarten program for students with disabilities in Miami-Dade County Public Schools started as a pilot program at the Debbie School. As you can see, some of the video was pre-COVID, so the kids and teachers weren't wearing masks, but since the pandemic, we have all been following CDC guidelines. We were one of the few centers in the community that remained open. And along with continuing to serve our young children with disabilities, we provided distant learning for all of our families, so we were able to continue their educational programs. And then we served the children of frontline workers and first responders. We follow all of the CDC guidelines. We were one of the first centers to experiment with young children using masks, and because of our success, many other programs have followed our guidelines. As a demonstration school, we're a center of excellence. We follow innovative educational strategies, we train university students, and we provide community support, and we also work on changes in public policy. We have 3 educational programs at the Debbie School.
Hi, everybody.
One is our auditory oral education program, which is for children with hearing loss.
I'm Lynn Mishkel. I'm a speech-language pathologist and audiologist, and I'm the director of the Auditory Oral Program here at the Debbie School. The program is for children who are deaf, hard of hearing, whose families have chosen a listening and spoken language approach. So that means they've chosen for their children to have technology, hearing aids or cochlear implants, in order for the children to have auditory access.
Thank you.
We're very fortunate now that we have technology to help our children with hearing loss. Children can be diagnosed with hearing loss as newborns, but the families really need support as they go through that journey. We work really closely with the Mailman Center audiology team and the Department of Otolaryngology here at the university, the Ear Institute. We work to support the families as they go through helping their children learn to use their auditory equipment and learn to listen and talk. So we have 5 classrooms where we support those children.
You can put it away in your backpack.
We have teachers and speech-language pathologists who are specialized in creating a language-rich environment for the children to blossom in their oral skills. Our goal is for the children to be ready to go out into regular education, just like their hearing peers, and to be able to be successful and maximize all their future potential.
3.
And then we have our early education program, which serves children birth to 3 with varying exceptionalities.
The Debbie School Service Coordinator works closely with Early Steps to enroll children. Our referrals come from Early Steps North, housed in University of Miami Mailman Center, as well as Early Steps Southernmost Coast, which serves children from South Dade to the Monroe County. Our children have come to us with varying exceptionalities, such as developmental delays, including motor development and communication, autism, Down syndrome, just to name a few. Our children are placed in one of our 6 inclusion classrooms or in our 1 self-contained classroom for children who need a little extra help and are maybe more involved. Our children receive therapy as needed, physical, occupational, and speech-language therapy.
Look at your picture.
Therapy is delivered in the classroom model or as a pull-out model. Therapists work really closely with the teachers in the classrooms to give them support, as well as with parents to provide them with services and strategies to use in the home. My role as a service coordinator is to support families when they enter the program through the years that they're here with us, to help them to accept or to understand their child's diagnosis or condition.
And then we have our early childhood education program, which is for children without disabilities. And those children serve as role models in our inclusive classrooms.
The Debbie School's Early Childhood Education Program serves children birth through age 5 of University of Miami Miller School of Medicine faculty and staff. In addition, we also serve some families employed at Jackson Memorial Hospital and the surrounding Civic Center area. We are fortunate that as part of the university, we are able to support families needing quality childcare, and the children enrolled become our role model students in our inclusive classrooms. We have a total of 10 inclusive classrooms where we do thoughtful inclusion, depending on the children's abilities and individualized needs. In these classrooms, children with disabilities can look to their role model peers for support, and children without disabilities become more accepting and comfortable of other children with special needs while learning empathy and compassion. It really benefits all involved, as the children really have so much to learn from each other.
We have many, many success stories at the Debbie School. Part of our mission is to ensure that young children with disabilities are successful in the mainstream and are able to go into general education and have successful careers. And we have parents and students come back all the time to tell us about the many, many things, important things that they're doing in the community. We have kids that are Boy Scouts. We have students who are at universities throughout the country and in Florida. We have several kids that are out working now in our community.
I was a really young kid. It was after going through cochlear implantation surgery, and my family essentially didn't really understand what the process was like. We never really expected the experience that I would go through. So the Debbie School was a perfect place to not only receive the necessary auditory oral education, but also provide the vital community that I needed in that stage of my life. And to this day, we still keep in contact with a lot of the teachers and administrators at the school. It definitely provided a solid foundation. And I can say without a doubt, I would have never been able to attend the University of Pennsylvania or do the kinds of research that I'm doing there without the Debbie School.
We really look forward to the Debbie School continuing to be a very, very vital part of our community.